Good morning, everyone.
Good morning.
Am I doing good this morning?
Yes.
Good. My name is D'Angelo McCants, and I hope you all can see the screen. I want to block y'all. Can you all see?
Yes.
Okay, all right. I'm D'Angelo McCants. I'm your local senior advocate. And what that means is I advocate for you in the community as far as your health, care, and different needs for seniors in the area. So you'll start seeing me around here. I'm gonna come visit y'all all throughout the year, and we'll get to know each other and be friends before the year is over, okay? Today I brought you a nice presentation. It's called What You Need to Know. And it's gonna be some urgent insights because as we know, we're in the annual enrollment period for Medicare. And I know if you like some other people I've talked to, you're being bombarded by phone calls, by letters, by people trying to get to you. So we're gonna talk about that a little bit. All right, I'll show you some tips and some tricks on how to navigate through this time of year. All right, got a little slideshow. All right, first question, has your Medicare provider reached out to you? Oh, yeah, okay.
Everybody else is too.
Everybody else is too. I know the phones are ringing, the letters are coming in. All right. And ask you a quick question. Has everyone received your annual notice of change from your insurance carrier? Yes. A letter in the mail? Yes. Okay, most of you have. Good. They came out late this year. They were supposed to come out earlier. I still talk to some people that haven't received that letter yet. But there is some delay this year, but hopefully you all got that letter. All right, so what we're gonna talk about is staying up to date on your plan. Ensure your Medicare provider has given you all the latest details about your coverage. Now the letter, the annual notice of change, will tell you all the changes to your plan that's happening this year. With the Medicare Advantage plans, if you're on Medicare Advantage, every year the plan has a possibility that it can change. Okay, this year we've had some significant changes. Some plans are not available anymore. Some plans have increased in rates. Some plans don't offer all the benefits that they offered before. Some plans don't have all the perks they had before. The only way you can know that is if you go in and you check, or if you read that letter thoroughly to see what's changed, or you get someone to go over it with you to see what's going on with your plan. You need to understand your options. Know what's changing and explore any new choices available to you. Okay? Again, with these plans, they're from year to year. They're not permanent plans. It's in your best interest to make sure you get the best benefits every year. Okay? So, I know a lot of people have loyalty to some of these companies, but the loyalty should be to yourself, getting the best benefits, getting the best cost, and making sure you're looking out for yourself and you're getting the best plan, because these plans change from year to year. They're not permanent, and you don't have any obligation to stay with one carrier. You should be looking for the best benefits and what benefits you the most. Don't miss your critical updates. Ignoring calls or messages could mean missing essential information that affects your health care. Okay? All right, I already asked y'all this, but have you been bombarded by calls from Medicare agents? Yeah? What's the average calls y'all get per day? 5, 6, 7, 8
I'm
calls?
on rain on, so I don't gotta worry about
Okay.
it.
I think Nancy said she been getting a lot of them, Miss
Yeah.
Bessie
I
said.
get probably close to 9 or 10 a
10
day.
a
Ooh, you gotta learn how to block.
Oh, I do.
Block,
I do.
block.
That's absolutely right. She's telling you right. So, some ways to stop those calls, because you still got 2 or 3 weeks left.
Don't turn your phone back on.
Don't turn your phone back on. That's one way you're gonna miss all your calls. You're gonna have your phone.
Hey, but it ain't on to start with.
Okay. You got a couple of ways to stop this from happening. You can add your number to the do not call list. Reduce unwanted calls by registering your number for added privacy. If you haven't added your phone number to the do not call list, I can show you how to do that at the end today. I'll show you how to add your number to the do not call list. Now I'm gonna tell you that will reduce the calls that you receive, but it's not gonna absolutely eliminate people from calling, but it will reduce it greatly. Okay, so you can register that number for the do not call list. Use your voicemail to screen your calls. All right? If you don't know the number pops up. Me, if the number comes on my phone, the name, if it's not a name attached to it, I don't answer that call. I let it go to voicemail, and then I go back and I check the voicemail. If they leave a voicemail, I can see who it is. And that's a way for you to screen the call, right? You know who it is. If you want to talk to them, you call them back as well.
On your, if you have an iPhone, there's a stop calls where it won't even ring if it's an unknown number. And then you can go back and look if they did, the number will show up. But if they leave a message and you see that it's for annual enrollment, then I delete the message, go back and block that number.
You heard that? If you got an iPhone, it's a feature where you can stop those numbers from coming in, and then you can go back and review and block the number if you don't want to deal with that
Yeah,
person call.
that's how I know how many are calling me.
That's a lot. Okay, and like she said, block persistent callers. These people call you every day. As soon as you wake up, your phone is ringing, they call all day long. Okay? Don't hesitate to block numbers that repeatedly contact you without your consent. Okay? Block them without no remorse. You know, block them. They can't call you anymore. Okay? Y'all smart. Y'all already know most of this stuff, but it's a refresher for some people don't know. And just navigating through this annual enrollment period. Do you know what to do if you suspect Medicare fraud? All right, I'll tell you a quick story. I had a lady, I was talking to her on the phone, and she said, I have a plan, I like what I have. I said, that's fine, but can we go through and check and make sure everything is gonna be good? You got all your doctors, you got all your prescriptions, you got all your providers still in the network. She said, okay. So as I started going through her review with her, we ran into a little problem, so I had to call, you wanna come in? No? All right, come in if you want to. It's okay. Just having to get together. So with the lady, I had to call Edna. She was with Edna. And we called Edna. There was a discrepancy on her policy. And I was asking Edna, and they said, well, she's not on the plan. She's telling you she's on. I said, why can't she not be on the plan? She's on the plan. I asked her if she'd speak to another agent and change. She said no. She started going through the lady's account with Edna. She said this plan has been changed 20 different times by 20 different agents. And I asked the lady again, I said, have you spoken with anyone about this? She said no. And the Edna people, they didn't know anything about it. They don't know how it happened. I asked, I said, how can this happen? That you allow people to come in here and change these plans over and over and over again? She said, I don't know. I just answered the phone. So, and that's happening. I mean, there's a million stories like that that's happening all the time. You assume that you have a plan that's going to just roll over nicely to the next year, maybe, or maybe not, I don't know. But it's good if you have a trusted agent, if you take maybe 15 minutes to go through everything, make sure everything is good for next year, and then you don't have to worry about anything. Block everyone else, don't answer your phone, and be ready to go for next year. All right? Most important thing is that you guard your Medicare number like it's a credit card. These people calling you, hey, blah, 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 I'm such and such. You know, you don't know who they are. They're on the phone. You never heard of them. You don't know who they are. Don't give anybody your Medicare number over the phone if you don't know who they are. You don't trust them. It's like giving them your credit card. They can take your card. They can charge to it. They can charge claims to it. They're very sophisticated scammers. They take your card number and they give it out. They make claims to it. Somehow they make money off of it. I don't know how it works. But they do it all day, every day. Never, ever give your number to some stranger over the phone that's asking for your Medicare number. Okay? Guard that number, don't give it to anyone. Treat your Medicare card like a credit card. Never share your number with unknown callers. Beware of free offers. Okay? Again, the scammers, the fraudsters, they call people, they say, hey, sign up with me, and I give you a free trip to the Bahamas. Okay, I'll give you a free car wash. I'll give you something free if you give me your information, and I'll sign you up. Okay, we should all be aware that enrolling in Medicare is free of charge. No one can charge you for that. There's no charge associated with that, as well as Medicare doesn't allow for agents to give you any type of gift. Okay? If the agent is offering you something free, some free gift or trade-off, that's illegal. They're not able to do that. They're not telling the truth because they cannot do that by law. They cannot give you anything by law. No gifts, no money, no card, no gift card, anything like that for enrolling in the plan. So beware of that free offer. Next, report suspicious activity. If you notice any unusual requests or charges, report them to Medicare or your trusted advocate immediately. Okay, call the 1-800 Medicare number and say, hey, I'm getting a letter about a claim that I never submitted on my account. I need to check into that. Or some persons keep calling me, offering me something free. Just call the 1-800 Medicare number, and you need to report that so they can continue to operate, okay? Are you aware of important changes in your Medicare coverage? I know a lot of you say you got your annual notice of change, but sometimes those annual notice of change is 10, 15, 20 pages, I don't know, a whole booklet.
I got a whole book.
Okay, you get a whole booklet, right? Now, if you're a diligent person and you want to go through all that and look and see and compare, okay, is it the same this year? What's changed here? Do I still have this benefit? Is my doctor still with this plan? Is my medication still on tier 1? Am I going to pay the same price for this medication? I don't know. If you have time, you want to do it, that's perfectly fine. That's the best rule of thumb to go through. That's why they see the annual notice of change. It's your chance to see what's different with your plan. Because as I said, those plans are from year to year. They have the ability to change every year, and they will change every year. So if you have got your annual notice of change and you haven't looked at it, you need to look at it. Because while you may think it's okay and it's the same plan, it has the same plan name, but that doesn't mean it's the same plan. It can have different benefit amounts, it can have different out-of-pocket amounts that you're gonna pay if you use it. It can have anything different, but you have to look thoroughly on that through that annual notice of change. Like I said, a lot of times it's thick, it's a lot of pages. But you yourself or someone, a family member or a senior advocate or a trusted agent needs to go through that with you and see if there are any changes. Because if you have a specialist that you like to use, and now that specialist is not in that network anymore, and you go next year and you say, I'm gonna go see my specialist, and then they say, well, hey, we don't accept this insurance anymore. Like, Cigna's having a lot of problems with the providers around here. And they say, hey, we're not with Cigna anymore, we don't accept the insurance. Either you're going to get a new specialist, or you're going to have to get a new provider, or change your insurance. Okay? So that's something you want to know going into the year, because all these plans start again on January 1st, the Medicare Advantage plans. Anyone on the supplement plan with me? No? Advantage plan? Okay, great.
No, supplement would be like.
Medicare? Medicare?
No, I don't have that. But what would United Healthcare be under?
They have advantage plans and they have supplement plans.
I think I'm on a supplement
Okay,
plan.
a supplement plan is usually called Plan G, Plan F.
Yeah, I think that's what I
Medicare,
got.
Advantage, okay. Supplement plans never change, so you don't have to worry about those. But the advantage plan changes every year. It's not guaranteed to change, but it has the possibility to change. These companies are for profit, so they're trying to make money. They're gonna cut wherever they can cut, and put money in their pocket. So you need to make sure that you're getting the same benefits or better. Say if you had United Healthcare, and they were good last year, they were okay, they were doing everything, you didn't use it a lot, it was okay. But if they went up in rates or they went up in out-of-pocket costs, you need to compare that, and you need to see, well, hey, maybe one of these other companies like Humana has a better plan now for me. They can cover the same things. You go to the same doctor, nothing's gonna change except for the name of the company. But if it's gonna cost you less money, and give you better benefits, there's nothing wrong with changing companies. Okay? The only way you can know that is to comparison shop, look at these plans and see what they're offering from year to year. They're all in competition, so you may get something better from one than the other. But you need to check and see. All right, again, excuse me. Check your doctor's network status. Okay, that's very important. A lot of these doctors are tired of the plans. They say, hey, these people paying me slow. I don't wanna deal with them anymore. I'm gonna drop out of this plan. I'm not in that plan anymore, okay? Some of them will send you a letter, they say, hey, I'm not accepting this insurance anymore. You need to switch carriers or you're gonna have to find a new provider. Okay, not all of them gonna send you a letter. It's up to you to check and find out. Ensure your preferred doctors are still covered under your plan to avoid unexpected out-of-pocket costs. Because if they drop out of that plan and you still continue to go to them, you're gonna be out of the network. And those charges are, out-of-network charges are a whole bunch more than as if the doctor was in the network. So they may accept you, but it's gonna be out-of-network, and you're gonna pay a lot of money to go see that doctor. Confirm your hospital coverage. Same thing with the hospitals. Mobile Infirmary, Providence, all these different hospitals around here. Make sure that they're still in the plan that you currently have. Okay? You can go in, it's just a quick check. Is this hospital, is this medical clinic still under the plan that I have right now? Okay, check it, verify it. If it is, great. If it's not, then you need to make a choice. Either a new plan, or you're gonna have to find a new hospital or clinic or wherever you're going. And one of the most important things is review your prescription drug changes, okay? These carriers have the ability to update their formulary every year. You know, they have different tiers, tier 1, tier 2, tier 3, tier 4. Depends on what type of prescriptions you're taking. They may move them to a different tier, they may charge a different price, they may kick them all the way out the formulary. They can do anything, but again, everything's about verifying, verification. You wanna check, I'm taking this drug, this drug, this drug, is it still covered by my plan? Now, some of the drugs are cheaper, it's okay, but I understand a lot of these prescriptions can be quite expensive. So you wanna know if you're still gonna be covered by your insurance for those particular drugs, and at what level. Because different levels cost you a different amount in your copay, okay? Some medications may have been removed or changed in cost. Confirm that your prescriptions are still covered under your plan. All right. Do you have a trusted senior advocate? All y'all have agents? They signed you up last year. Have you heard from them this year? They call you once a year around annual enrollment period and see if they can sign you up again. Okay, that's something to consider. Do they stay in touch? Do you hear from them throughout the year? Are they saying, hey, how's everything going? Is the insurance working for you? Do you need any help with your claims? Do you need any help with this? Can I assist you in any type of way? Do they help outside of Medicare? Okay? Everybody's getting those calls now, 8, 9, 10 calls a day. Different agents calling you, hey. But then, once the period is over with, it's probably quiet, right? Don't hear from anybody, you're not checking on you.
Are the advocates obligated to call? Is it like their job to keep?
Well, they're not advocates, they're agents.
Yeah, the agents, are they obligated?
No, obligated. No. Their goal is to sign you up.
And that's it.
Yep, that's it. They're gone, and they may save you in their database, and then next year they're gonna say, call that person again, see if I can sign them up again. And most people do just because they don't have anyone else to go to, or they don't know any better. Maybe that's the service they think that they're supposed to receive. But there is better service. Do you have their cell phone numbers? A lot of times you call and you sign up at some call center, okay? You'll never speak to that person again if you call and sign up at the call center. That person doesn't know you. You don't know that person, you'll never hear from them again. Some of these local agents, you won't hear from them again. Maybe you don't have any way to contact them if something's going on. You got a question, you need assistance, probably don't have any way to contact them. Okay? And the last question, are they senior advocates? Are they working on your behalf in the community? Are they working in your behalf? Will they talk to the insurance companies on your behalf? If you need a pre-approval or something like that, are they gonna take the time to call these companies, the doctor, coordinate the hospital, the insurance, and make sure that you're getting the service that you need? I have to answer out loud, but I know the answer to these questions pretty much. They're good for one time a year. You hear from them for an annual enrollment period, but most likely you're not gonna hear from them again. And that's the difference between a senior advocate, someone who's advocating for you throughout the year, who's working with you to make your experience better, and a simple insurance agent, as I like to say. All right? Gentleman there. All right, so that's basically the rundown that I wanted to give you all. So what I want to do today also is I want to suggest myself as your senior advocate. You can get in touch with me. I'm a local person. I live here in Mobile, lived here all my life. I'm more than an agent. I am an agent broker. I work with all the carriers in the area, but I'm also a senior advocate. You'll see me around. Like I said, I'm going to start doing educationals throughout the senior centers in the area, bringing you education, working side by side with SHIP, the SHIP office. You know, when they come out with information, they can't reach everyone, but I'm going to work with them, and I'm going to come out. If there's some type of change in Medicare, or there's some type of program they're offering that could assist you in getting help for something you need, I'm going to bring that information to you. I'm going to be available. I'm going to be a person of contact that you can actually talk to and reach. And hopefully throughout the years, I get to know some of you, and y'all feel comfortable with me. That's just my information. Like I said, I'm here in Mobile. I'm an insurance broker. I'm with a company called Senior 65. We have a large presence on the internet. They do advocacy throughout the nation. They have a YouTube channel where they bring different topics every week about like insurance fraud, Medicare updates, just things to benefit seniors to live a better life overall. Healthcare, financial things, family-related issues, and whatnot. Okay? Excuse me. So, that's my brief presentation. We can have a question and answer if you want to. Do anyone have any questions? Yes, ma'am.
Since you're a financial professional,
Yes, ma'am.
what other financial stuff you cover other than the, do you do other than just senior citizen?
Yes, I do. I'm an insurance broker, so I do life insurance, health insurance, long-term care, in-home care, hospital indemnity. Now, that's something I didn't touch on, but you know, a lot of these policies, if you don't have a Medicare supplement plan, if you actually start using some of these Medicare Advantage plans, they have some significant out-of-pocket costs that you could face. If you're not financially prepared for those costs, then you're going to be paying, I don't know where you're going to pay it from, but you're responsible. So if you go to the hospital for like $200 a day, maybe, if you're in the hospital for 3 or 4 days, now you owe thousands of dollars for being in the hospital. So being a financial professional means covering those gaps. Your hospital indemnity policies, which are very low cost policies, maybe you pay $30, $40 a month for that. But if you go to the hospital, those policies will pay you money to cover your gaps that the Medicare doesn't cover. Okay. Also, like I said, short-term care. If you're an independent person and something happens and you get sick and you need to stay in your home, but you need some assistance. If you have some type of protection in place where that happens, you know, you're not trying to pay out your pocket, you're not burdening your family members, you still have your independence, you can have someone come in and take care of you, and that's all gonna be paid for. Long-term care, same thing. It's gonna be a long-term health issue. You have coverage in place that's gonna pay you, okay? Financial professional, when I speak about it, is for protecting your finances. You don't want to pay money out of your pocket for these different things that's going to happen as we age and things happen, okay? Accident policies, if you happen to fall, hurt yourself, something like that, you want to have something in place where it's going to give you money to take care of. Maybe you still work or you do something, you take care of your grandchildren. You want that money to continue to come in and you don't have to worry. You can recover. And you can still live your life like normal, but you have the finances to take care of whatever arises. And that's what I mean when we say financial professional. It's just covering yourself financially for anything that may arise, because we know, unfortunately in life, things happen we don't have any control over, but if you plan ahead, you can have coverage or things in place to take care of those things that are going to happen to you It's not gonna take money out of your pocket, but it can put money in your pocket, okay? Some of these coverage plans, they will give you more money than what's needs to be covered, and you can actually pocket some of that money and do something nice. A lady in our company, she always says, why take good money for bad situations when you can take, have something in place where you don't have to use that good money for a bad situation. Have something in place, sit down, spend a little time, look at everything that you need to, plan ahead and have that taken care of. Okay? But again, like I said, I'm a senior advocate. I'm coming around, I'm talking to people, I'm seeing what the needs are, what can I address, what can I help with. I'm not gonna be here annual enrollment, then you see me again next annual enrollment period. Okay? You're gonna see me a few more times in between. Right now, I have this sheet. If you like to have my information, if you like to send me your email, I can send you an email. I'm gonna start a newsletter. I'll just pass this around. Let me get to this later first. I'm gonna come pass that around. If you want me to contact you, put you on my email list, I can do that. If you haven't reviewed your ANOC, and you need to review your ANOC and make sure all these things I said, you have your doctors, you have your medications and all that good stuff in order before 2025 starts. I'll be glad to do that with you, or whatever other questions or concerns you have. If you'd like to reach out to me, that's fine. Put your information on there. Or you can write down my information here, and you can contact me. I have my email, my phone number there on the screen. Anyone have any other questions, concerns?
Thank you for coming.
I hope that was helpful for y'all. I look forward to meeting with y'all again sometime in the future.
So I was gonna mention one thing, because I'm retired from the military and I volunteer there now. The gap when you're an inpatient is like 350 now per day for the first 4 or 5 days.
Is this a hospital stay?
Yeah,
That's gonna answer quick.
and emergency room charges, I think $250 on average,
It's very expensive.
just to walk in there.
Medicare's not gonna pay all that.
Yeah,
You gotta get that bill, and so you gotta pay that.
yeah.
Like I said, we do have policies that as low as $30 a month for hospital indemnity.
Yeah,
And as soon as you go to the hospital, you file a claim, and I'll cover that. Depends on what you choose, you can actually pocket some money
yeah,
after paying that, so. It's very cost effective. I know all of you are on advantage plans now, so that you don't have the luxury of having the supplement plans. Supplement plans are a little bit different. They cover those gaps, and they pay for most things you don't have to pay out of your pocket. But those protection payment plans that I'm speaking of, they work the same way as a supplement plan. Like she's saying, you go to the hospital, you're gonna have some gaps, you're gonna be responsible for paying those things. But if you get that coverage, you're gonna pay one or two ways. You can pay up front, you can pre-plan, you can think about things, the possibilities of things happening, you can get that plan in place. Or unfortunately, if something happens and you have to go to the hospital, to emergency room, something like that, you're gonna be out of a lot more money than you would be if you just took the time to get that plan. That's just something to think about.
oh, yeah.
I'll be around, I'll leave my information here with the ladies. If you want to reach out to me, feel free to do so. I'll be glad to hear from you. Any other questions, concerns?
Thank you.
All right, thank you all. Thank you for your patience. My grandma said we all related, so we probably are related. I have it with my name real.
You got a cell phone?
I got
You can come here and take a picture.
With me. I'm gonna give you
One
information
question.
to this.
Okay, yeah, cause I would.
Your life insurance, do seniors get any kind of special rate? Thank you. I'll tell my husband.
All right. Give me a call anytime. Like I said, I'm gonna leave my information with the ladies at the front.
Thank you so much. Well, I took a picture of that
Okay,
and
good.
wrote down the stuff.
Thank you, I appreciate it.
Thank
Thank you. Like I was telling him, I just wanna
Come back again, okay.
come back a few times real
Okay,
good.
that'd be good. I got your stuff, all the information assigned up, have you come. I can give you a call and set it up.
Okay.
Did you get all your stuff recorded?
I think so.